We're starting off on a bright note, a good note, I should say. Now, if you've been following the story of Ganiyat Popoola, now she's a medical doctor at the Kaduna National Eye Care Center. She was kidnapped in December of 2023. Well, she's now regained her freedom. And while details of her release are still unclear, reports confirm that Dr. Popoola and her nephew were freed on Wednesday evening. Earlier in the year, healthcare workers in Kaduna held a peaceful demonstration urging the immediate release of Dr. Popoola, who had been in captivity at the time for about 8 months. Well, the doctor, who was a mother still breastfeeding her baby, was taken from the doctor's quarters at the National Eye Care Center after armed intruders breached the facility's perimeter fence. Colleagues emphasized that her abduction deeply unsettles the medical community and highlighted the escalating security risks faced by professionals. Olamide, we were speaking about this just before the show started, looking at the many dimensions, but we are also mindful of the fact that, this this abduction, had more or less trailed or dominated the medical space, all through the year, since December when the incident happened. I think it was even, it even formed the bedrock of at least two industrial actions that the Union of Resident Doctors embarked upon in their bid to, secure the safe return of Dr. Popoola.
Oh, well, I think it's a great one. It's a great news. But it's also important for us to, continue to raise concerns about the security issue, especially that health professionals face. An injury to one is an injury to all, like they also mentioned while they were trying to, register their concerns. It's not a good thing for health workers to live in fear while trying to, do their jobs. These are some of the reasons for brain drain that we see and all of that. It's beyond, remuneration and all that. A safe work environment, a healthy work environment, these are the major factors that help, job satisfaction. And so it's beyond that. Well, it's great news. I don't even want to, think about the trauma, the psychological effect it may have had on the husband who was a part of that kidnap and was released and had to, stay back while his wife and the nephew were still in custody. So these are issues that, while it's great news also, but we should not also rejoice totally because the abductors decided to, release. It's just one situation. These people still live among us. They're not people from outside the country. This happened in an hospital environment. And like I said, an injury to one is an injury to all. If this continues, then we'll still be having, a lot of brain drain in the nearest future.
Absolutely. And as you have said, this is just one more case. We still have several others in captivity. It's good to know that Dr. Popoola is now back at home with her loved ones. We're also speaking about the state of her health. Of course, she's a medical professional, trained to care for others, but, obviously she needs some form of therapy, some form of rehabilitation. Almost a year in the hands of your captors. Know how, we don't even know the condition, but we understand a ransom was paid according to the union, but at that, as the union had said at the time when they were clamoring for her release, it's an agency's job, at least one agency's job, to ensure the safety of Nigerians. It is our job as a union to ensure the well-being of our patients. So let the agencies in charge do what they're supposed to do, and so we really don't know, but of course we understand that she's been shielded at the moment. Only people that are very important to her. She really needs to heal now. She has a baby to attend to. Apparently she had been separated from her baby for this much. The nephew also, and of course once again there are still others in captivity, and this is another opportunity for the clamor, another clamor for the release of, so much. We have people that have even been in detention or captivity for way longer than, this almost a year that Dr. Popoola and her nephew were in captivity. It's really a sad one. at that. But once again, thank God for life.
We wish them luck.
Yes, because
and
we've had
strength to
absolutely
manage this
to move
situation.
on,
To
because
move on. Yes,
there
that's
is
very
life.
important.
There is life. Healing is crucial at this time. All right. Still in the news at this time, of course, as the days follow, there will be more developments regarding this story of this news development of Dr. Ganiyat Popoola's release. In the meantime, let's bring you some more developments elsewhere. President Bola Tinubu has appointed Major General Olufemi Oluyede as the new acting Chief of Army Staff. Presidential spokesperson Bayo Ononuga confirmed this development to TVC News. Mr. Ononuga says Major General Oluyede will be the acting Chief of Army Staff pending the return of Lieutenant General Taurid Lagbaja, who is said to be indisposed and receiving treatment abroad. Let's tell you what we know about Major General Olufemi Oluyede. He served as the 56th Commander of the Elite Infantry Corps of the Nigerian Army based in Jaji, Kaduna. The 56-year-old Major General, as well as the Lieutenant General Lagbaja, were course mates and members of the 39th Regular Course. He was commissioned a second lieutenant in 1992, effective from 1987, and rose to Major General in 2020, September 2020 to be precise. The acting Chief of Army Staff has also held many commands since his commissioning as an officer. He was platoon commander and adjutant at 65 Battalion, company commander at 177 Guards Battalion, staff officer, Guards Brigade, commandant, amphibious training school as well. He also participated in several operations, including the Economic Community of West African States Monitoring Group mission in Liberia, Operation Harmony 4 in Bakassi, and Operation Haddon K in the Northeastern Theater of Operations, where he commanded 27 Task Force Brigade.